Adenocarcinoma of prostate. It is the most common cancer of males. Most common cancer of males. Adenocarcinoma of prostate. Most common cancer of males. Age greater than 50 years. Age greater than 50 years. Site. Posterior aspect of peripheral zone is the most common site. Posterior aspect of peripheral zone is the most common site. Posterior aspect of the peripheral zone is the most common site. Etiopathogenesis. Etiopathogenesis of prostatic adenocarcinoma. Advancing age, hormonal influence, androgens play a role. Advancing age, hormonal influence may androgen play a role. Racial factors. Black are frequently affected. Blacks are frequently affected with prostatic adenocarcinoma. Environmental factors. Dietary influence play a role. Androgens play a role. Blacks are frequently affected. Dietary influence play a role. Geographic factors uncommon in Asian. Prostatic adenocarcinoma is uncommon in Asian. Family history. Increased risk for men with first degree relatives with prostate cancer. Increased risk of men with first degree relatives with prostate cancer. Etiopathogenesis. Advancing age, hormonal influence, androgen play a role. Racial factors. Black are frequently affected. Environmental factors में dietary influence play a role. Geographic factor में it is uncommon in Asians. Family history. Increased risk for men with first degree relative with prostate cancer. Genetic alterations. Germline mutation involving genes such as BRCA2 and HOXB13. Germline mutation involving genes such as BRCA2 and HOXB13. Acquired mutations such as overexpression of genes ETS, overexpression of the gene ETS, amplification of the gene MYC, overexpression of the gene ETS, amplification of the gene MYC, deletions involving genes P10 and RB, and loss of T53. Genetic alterations, germline mutation involving genes such as BRCA2 and HOXB13. Acquired mutations such as overexpression of the gene ETS, overexpression of gene ETS, amplification of gene MYC, overexpression of gene ETS, amplification of the gene MYC, amplification, overexpression of the gene ETS, amplification of the gene MYC, deletions involving gene P10RB and loss of TP53, deletions involving the gene P10, TP53 and RB, deletions involving the gene P10, RB and loss of TP53. Genetic alterations, germline mutation involving the genes BRCA2 and HOXB13, germline mutation involving genes such as BRCA2 and HOXB13. Acquired mutations such as overamplification of ETS, overexpression of ETS, amplification of the gene MYC, deletions involving gene P10, RB and loss of TP53. Precursor lesion is prostatic intraepithelial neoplasia. Prostatic intraepithelial neoplasia is the precursor lesion. Morphology, gross morphology, gritty and firm growth. Gross morphology, gritty and firm growth. Microscopy, well differentiated tumors show uniform round crowded glands lined by a single layer of cuboidal and low columnar epithelium. Well differentiated tumors show uniform round crowded glands lined by a single layer of cuboidal or low columnar epithelium. Well differentiated tumor show round crowded glands show uniform round crowded glands lined by a single layer of cuboidal or low columnar epithelium. Cytoplasm appears pale clear to amphiphilic and nuclei are enlarged with large nuclei. Cytoplasm pale clear to amphiphilic. Cytoplasm pale clear to amphiphilic and nuclei are enlarged with large nucleoli. Cytoplasm appears pale clear to amphiphilic. Nuclei are enlarged with large nucleoli. Poorly differentiated tumors show tumor cells infiltrating the stroma in forms of cot seats and nest. Poorly differentiated tumors show tumor cells infiltrating the stroma in form of cot sheets and nest. Grading. Gleason system grades prostate cancer from grade 1 to grade 5. Gleason system grades the prostate cancer from grade 1 to grade 5. Grade 1 is well differentiated. Grade 5 mean there is no glandular differentiation. Gleason score is obtained by adding the primary grade assigned to the dominant pattern and the secondary grade which is given to the second most frequent pattern of the tumor. Gleason score is obtained by adding the primary grade assigned to the dominant pattern and secondary grade given to the second most frequent pattern of the tumor. Clinical presentation: asymptomatic, nodule felt on rectal examination. Asymptomatic, nodule felt on rectal examination. Later urinary symptoms, difficulty in starting or stopping the stream. Frequency: later urinary symptoms like difficulty in starting or stopping the stream. Frequency: dysuria and hematuria. Investigations: elevated PSA level, elevated urine PCA3 scores, elevated PSA levels, elevated urine PCA3 scores, elevated PSA levels, elevated urine PCA3 scores. Digital rectal examination, transrectal USG, transrectal needle biopsy, transrectal USG and transrectal needle biopsy. Metastasis: lymphatic spread involves obturator and para-aortic nodes. Lymphatic spread involves obturator and para-aortic nodes. Hematogenous spread involves mainly bones. Producing osteoblastic secondaries. Hematogenous spread involves mainly bones, thus producing osteoblastic secondaries. Causes of prostatic enlargement is BPH and carcinoma of prostate. Prostate cancer Gleason grade group. There is Gleason grade group. There are 5 grade groups. Grade group 1, the score is less than or equal to 6. Grade group 1 score is less than equal to 6. It has only individual discrete well formed glands. Grade group 2, it's 3 plus 4. 3 means well formed glands, 4 means poorly formed fused cribriform glands. So grade group 2 has predominantly well formed glands with a lesser component of poorly formed fused or cribriform glands. Grade group 3 is 4 plus 3. So 4 is poorly formed fused or cribriform gland. 3 is well formed gland. So grade group 3 has predominantly poorly formed fused or cribriform gland with a lesser component of well formed glands. Grade group 4 is 4, 4 plus 4, or 3 plus 5, or 5 plus 3. 4 plus 4, 5 plus 3, or 3 plus 5. 4 plus 4, 3 plus 5, or 5 plus 3. It has only poorly formed fused cribriform glands. It has only poorly formed fused or cribriform glands, or predominantly mix of well formed glands and lack of glands. Poorly formed it has only poorly formed fused or cribriform glands and predominantly mix of well formed glands and lack of glands. It has only poorly formed fused or cribriform glands or predominantly mix of well formed glands and lack of glands. Grade group 5, that is 5 plus 5, 5 plus 4, or 4 plus 5. Grade group 5 has the score of 9 or 10, that is 4 plus 5, or 5 plus 4, or 5 plus 5. They lack gland formation with or without poorly formed fused or cribriform glands. Lack gland formation with or without poorly formed fused cribriform glands. This is about prostatic adenocarcinoma.